Without Bell's help, a lot of these programs and initiatives wouldn't get off the ground. We discovered before the pandemic, which just worsened during the pandemic, that youth with significant trauma history really need an intensive day treatment program. And so the money that Bell donated to this day treatment program has really allowed for youth who've experienced trauma to really get the services that they need while they stay in school. Absolutely. We've worked with Bell for many years, and we're always appreciative for their support. This helps to provide treatment to youth that have experienced trauma in their lives. That's something that's very unique. What it also does is it helps to keep kids in the community. So rather than being, a revolving door of coming into the inpatient unit crisis after crisis, the money from Bell, LetsTalk helps us to keep kids in the community, keep them safe, and keep them learning. The other thing that it's done is also allowed families to get support. Many times when the youth come into the hospital or they're getting services elsewhere, it may be difficult for the family to be engaged. But now that they're in school and they're continuing their education while also getting the mental health supports, families are also part of the process, and they get their own treatment and their own therapies as well to help to learn how to manage their kids with these powerful emotions. At a time when mental health resources are scarce and funding is scarce, having the community and having a corporate sponsor like Bell step up to provide this type of funding to get these services going has been invaluable. What I always say to all community members, parents, families, loved ones, advocate for more funding when it comes to mental health and addiction resources. Get involved in your community. Many times we need volunteers to work on our mental health and addiction floors and programs. If you have an interest, get a hold of volunteer services at KHSC. There's lots of things the community can do, not just advocacy or volunteering. Sometimes it's just about combating stigma in your own backyard. If you hear someone making a comment about mental health, or you hear someone downplaying what depression or anxiety is like, speak up. Say something, combat that stigma, and make sure that mental health is treated the same as physical health.